Hello, everyone, and thank you for joining the U.S. Department of Health and Human Services Office of Minority Health's Technical Assistance webinar for the Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19 Funding Opportunity. My name is Sinceri Koff-Souza, and I'm with the Office of Minority Health at the department. I am joined today by Ms. Juliette Bowie, Team Lead in the Office of Minority Health, and Dr. Scott Moore, the Director of the Grants and Acquisitions Division in the Office of the Assistant Secretary for Health and Chief Grants Management Officer. A few housekeeping items before we begin. All webinar participants have been muted. Today, we will provide an overview of the funding opportunity announcement and the competitive application requirements. We invite you to submit questions throughout the webinar in the Q&A window on the right side of your screen. Please ensure that you select the option to send your question to all panelists. We'll respond to questions during the Q&A session and also in a frequently asked questions or FAQ document, which will be posted to grants.gov. This webinar is being recorded, and the recording will be available on OMH's YouTube channel. An important note, the information provided during this webinar does not supersede the Notice of Funding Opportunity or NOFO content. The NOFO is the written document that will govern the competition. We strongly recommend that you subscribe to the NOFO on www.grants.gov to ensure that if any revisions are made to the NOFO, you will receive an electronic notice. At this time, I will turn the presentation over to Ms. Juliette Bowie. Juliette?
Thank you, Sinceri. And could we please advance to slide 3? Thank you, and it's my pleasure to join you today with Dr. Moore to provide an overview of this NOFO. OMH is dedicated to improving the health of racial and ethnic minority and disadvantaged populations through the development of health policies and programs that will help eliminate health disparities. Through its demonstration grants, OMH supports the identification of effective approaches for improving health outcomes with the ultimate goal of promoting sustainability and dissemination of these approaches. Next slide, please. This notice solicits applications for projects to demonstrate the effectiveness of local government implementation of evidence-based health literacy strategies that are culturally appropriate to enhance COVID-19 testing, contact tracing, and/or other mitigation measures like public health prevention practices and vaccination in racial and ethnic minority populations and other socially vulnerable populations, including racial and ethnic minority rural communities. Applicant eligibility is limited to localities such as cities, counties, parishes, or other similar subdivisions. OMH encourages applicants to partner with a minority-serving institution for quality improvement activities and program evaluation. Next slide, please. The target population is racial and ethnic minority populations and others considered vulnerable for not receiving and using COVID-19 public health information. Next slide, please. A total of $250 million is available for up to 73 awards total, 30 awards for urban communities and 43 awards for rural communities for a project period of up to 2 years. Up to $4 million will be awarded per budget period per grantee focused on urban communities, and up to $3 million will be awarded per budget period per grantee focused on rural communities. This is a grant. Next slide, please. Classification of the applicant's focus area as either urban or rural communities will be determined based on the Health Resources and Services Administration Office of Rural Health Policy definition of rural and the Census Bureau's urban classification, where urban refers to urbanized areas of 50,000 or more people, and urban clusters of at least 2,500 and less than 50,000 people. Rural refers to HRSA-designated rural areas as defined by the Rural Health Grants Eligibility Analyzer. This webpage allows individuals to search by county or street address and determine rural eligibility. Next slide. OMH expects recipients to conduct project activities in the following areas. Number 1, disparity impact and health equity promotion. Number 2, health literacy plan implementation and sustainability. Number 3, community-based partnerships. And number 4, quality improvement and evaluation. Next slide. OMH expects recipients to develop a disparity impact statement using local data, such as data from the CDC Social Vulnerability Index, to identify racial and ethnic minority populations at highest risk for health disparities, low health literacy, and not being engaged or reached through existing public health messages and approaches for promoting COVID-19 public health recommendations, such as testing, contact tracing, vaccination, and other efforts to mitigate the impact of the virus. The Disparity Impact Statement will provide the framework for ongoing monitoring and determining the impact of the health literacy interventions on adherence to COVID-19 public health recommendations. See Appendix E, Disparity Impact Statement in the NOFO for details and resources. Next slide, please. OMH expects recipients to develop and implement a health literacy plan that incorporates the national standards for culturally and linguistically appropriate services in health and healthcare, and to increase the availability, acceptability, and use of COVID-19 public health information and services by racial and ethnic minority populations and others considered vulnerable for not receiving and using COVID-19 public health information. The health literacy interventions included in the plan should also promote changes in the healthcare delivery system broadly that advance healthy people objectives related to improving understanding, communication, and informed decision-making. The health literacy plan will provide guidance for new and/or revised policies for improving and sustaining adherence to COVID-19 and other public health recommendations, using evidence-based and culturally and linguistically appropriate health strategies. See Appendix C and Appendix D in the NOFO for details and resources. Next slide, please. The definition for health literacy is included in the glossary of the NOFO. Health literacy addresses both personal health literacy and organizational health literacy. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Next slide, please. OMH expects recipients to partner with local community-based organizations, including local health departments and community health centers, to develop and implement, number 1, the health literacy plan in order to ensure cultural and linguistic appropriateness for racial and ethnic minority populations and other vulnerable populations, and number 2, a plan for sustaining adherence to COVID-19 and other future public health recommendations. For the sustained adherence plan, partnerships should, number 1, increase the availability, dissemination, adaptation, and use of culturally and linguistically appropriate evidence-based health literacy practices and interventions. And number 2, ensure accurate, accessible, acceptable, and actionable training, health literacy practices, and intervention resources for the identified populations. Next slide, please. OMH expects recipients to partner with a minority-serving institution when possible, or other institution or organization, to establish and implement an ongoing quality improvement process and project evaluation. Minority-serving institutions are defined by the U.S. Department of Education as a category of institutions of higher education enrolling populations with significant percentages of undergraduate minority students, or that serve certain populations of minority students under various programs created by Congress. More information and a list of minority-serving institutions is in Appendix G of the NOFO. OMH expects recipients to use the quality improvement processes to refine the health literacy interventions that support improvements in the disparities identified in the disparity impact statement. The project evaluation should determine whether the health literacy intervention was implemented as planned, whether it reached the target population described in the disparity impact statement, and whether there were any changes in the access, use, and outcomes of COVID-19 vaccination, testing, and related activities. OMH expects recipients to provide periodic project data stratified by demographic characteristics on changes in the access, use, and outcomes of COVID-19 vaccine testing and related activities, and project data related to the Healthy People 2030 objectives outlined in the NOFO. Next slide, please. Your application project narrative should include the following components. Number 1, statement of need. Number 2, proposed approach. And number 3, organizational capacity. To facilitate the review of your application, we suggest organizing your narrative by these headings. You must identify an urban, as defined by the U.S. Census Bureau, or rural, as defined by HRSA, area of focus in the first sentence of your project narrative. Under statement of need, describe the scope of the problem that will be addressed by the proposed project, including the populations and geographic areas of focus, and including the disproportionate impact of COVID-19 on racial and ethnic minority populations in the geographic area of focus. Provide a table as an appendix using quantitative data to describe the target populations at highest risk for experiencing disparities in COVID-19 outcomes. These data should include racial and ethnic minority populations, COVID-19 positivity rate, households with more persons than rooms, uninsured populations, and populations with limited English proficiency, consistent with data in the CDC Social Vulnerability Index. Alternate data sources can be used if the SVI data are not available. Under proposed approach, at a minimum, you should demonstrate how health literacy strategies will be implemented to advance the Healthy People 2030 objectives and improve adherence to COVID-19 public health practices with high risk and underserved racial and ethnic minority populations in the geographic area of focus. Provide a list as an appendix that identifies the types of partners and their role in developing and implementing the health literacy and sustainability plans. Describe the quality improvement approach that will be used to refine health literacy strategies that support the access, use, and outcomes of COVID-19 health information and services for the populations in the geographic areas of focus. And describe the evaluation approach that will be used to determine whether the health literacy intervention was implemented in adherence with the national class standards, whether it reached its target population as described in the disparity impact statement, and whether there were any changes in access, use, and outcomes of program activities, especially COVID-19 testing, contact tracing, and vaccination. Under organizational capacity, describe a strategy for minimizing delays in project startup activities and the roles and responsibilities of project leadership in providing project management and oversight. Provide a chart as an appendix outlining the current and anticipated staffing who will be responsible for implementing key tasks and monitoring the project's ongoing progress. Identify the minority serving institution or other institution or organization that will be responsible for quality improvement and program evaluation, and a brief summary of their qualifications. Please refer to the NOFO for the full details about these components. Next slide, please. Please note the application criteria in the NOFO. We want to highlight a few criteria here, which you'll hear more about later in the presentation. Your federal funds, including direct costs, should not exceed $4 million per budget period for urban communities and $3 million per budget period for rural communities. Your project narrative should not exceed 5 pages, and the total application, including appendices, should not exceed 15 pages. Next slide, please. With the project narrative, applicants should also take note of appendices to submit as an attachment. Project partners. So for this, applicants need to include a table that lists partners that have been identified to develop and implement the project. The list of partners should include the partners that provide letters of commitment and specific roles, responsibilities, resources, and contributions of each partner. Documentation of commitment from partners, subrecipient organizations, and agencies. If available at time of submission, signed MOAs or signed letters of commitment may be submitted for each partner or one signed MOA with all partners and includes specific roles, responsibilities, resources, and contributions of partners to the project. A signed MOA or LOC should be submitted for the minority serving institution that will partner for the quality improvement and program evaluation. If the applicant is unable to submit signed MOAs, the applicant should submit an unsigned MOA. Applicants need to include an organizational chart that reflects the management structure for the project and demonstrates where the project resides within the greater organization. The chart should include a separate table that outlines the current and anticipated staffing who will be responsible for implementing key tasks and monitoring the project's ongoing progress. For summary bios for key project personnel, applicants need to submit a summary resume or biographical sketch not to exceed 2 pages per person for the project director or principal investigator and all other key personnel. You may use a format similar to the NIH biographical sketch. And finally, for project target population, applicants must submit a table outlining the target population to receive services and supports within the identified geographic area of focus using quantitative data. The data should include racial and ethnic minority populations, COVID-19 positivity rate, households with more persons than rooms, uninsured populations, and populations with limited English proficiency, consistent with data in the Social Vulnerability Index, or alternate data sources if FCI data is not available to describe the target population. Next slide, please. Federal staff and an independent review panel will assess all eligible applications according to the following 3 equally weighted criteria. Number 1, statement of need. Number 2, proposed approach. And number 3, organizational capacity. Disqualified applications will not be reviewed against these criteria. For statement of need, the application will be assessed based on how well the applicant describes the problem and contributing factors of the problem to demonstrate need for the project. The populations and geographic areas of focus described using data on demographic characteristics such as race, ethnicity, rural or urban community, limited English proficiency, and characteristics associated with social vulnerability and individuals at highest risk for experiencing disparities in COVID-19 outcomes. It will also be assessed based on how well the applicant demonstrates understanding of disproportionate impact of COVID-19 on high-risk and underserved racial and ethnic minority populations in the geographic area of focus, and how well the applicant describes the approach for developing a disparity impact statement. For proposed approach, the application will be assessed based on how well the applicant describes and discusses project details, including the project goals, objectives, and proposed outcomes, how feasible, data-driven, and culturally and linguistically appropriate the proposed approach is for applying health literacy strategies to improve the access, use, and outcomes of COVID-19 health information and services for the population of focus, how well the applicant describes the approach for implementing health literacy strategies to address the Healthy People objectives, how well the applicant describes partnerships with community-based organizations to support the development and implementation of the health literacy plan and sustainability plan, and describes an adequate quality improvement approach to refine interventions and support improved health literacy related to the access, use, and outcomes of COVID-19 health information and services for the populations in the geographic area of focus. The application will also be assessed based on how adequate and feasible the evaluation approach is for determining whether the health literacy intervention was implemented in adherence with the national class standards, whether it reached its target population described in the disparity impact statement, and whether there were any changes in access, use, and outcomes of COVID-19 vaccination, testing, and related activities, and how adequately the applicant describes the use of data stratified by demographic characteristics to advance the Healthy People 2030 objectives. For organizational capacity, the application will be assessed based on how well the applicant demonstrates a strategy for minimizing startup delays, how adequate the roles and responsibilities of project leadership are in providing project management and oversight, how well the organizational chart demonstrates adequate project staffing, and how well the applicant describes the partnership with an institution or organization for quality improvement and program evaluation. Please refer to the NOFO for all of the review criteria. Next slide, please. Applicants should refer to the appendices of the NOFO for more information, including on Healthy People 2030, health literacy resources, the disparity impact statement, and minority serving institutions. Next slide, please. You will hear more about the funding decisions later in the presentation, but we want to highlight some information from the NOFO here. The Deputy Assistant Secretary for Minority Health will provide recommendations for funding to the Grants Management Officer to conduct risk analysis. And in providing these recommendations, the Deputy Assistant Secretary for Minority Health will take into consideration applicants serving localities with the highest social vulnerability. This may be determined by being in the top fourth as defined by the CDC Social Vulnerability Index, county maps, or alternate similar data source if SBI is not available. Applicants with identified minority serving institution partners and equitable geographic distribution. Next slide, please. Here are some resources to consider for evaluation planning. I'll now turn it over to Dr. Scott Moore, our Grants Management Officer.
Thank you, Juliet, and good afternoon, everyone. Next slide, please. My name is Scott Moore. I'm the Grants Management Officer for the Office of the Assistant Secretary for Health, and I oversee the Grants and Acquisitions Management function for OASH. Our job in our office is to ensure a fair competition for any of our grant opportunities, including this one. We manage everything and every part of the process from an administrative and business point of view, from pre-award, which is the phase that we're in, all the way through the life of any awards that may result from this NOFO and through award closeout. So if you're successful in this competition, you will be working with us for a couple of years. But let's get into the competitive aspect of this. Next slide, please. First and foremost and most important, your application is due by 6 p.m. Eastern Time, Tuesday, April 20th, 2021. Not 6:01, but 6 p.m. It is a hard and fast stop. Your submission time will be determined by the date and timestamp provided by grants.gov when you complete and submit your application. We strongly encourage you to submit your application a minimum of 3 to 5 days prior to the application closing date. We are using a lot of electronic systems. Things can happen. We want to make sure that your application gets in on time. Another reason for doing this early is it may take grants.gov up to 48 hours to cycle and notify you of a successful submission. If you fail to submit your application by the due date and time, as we determine by that date and timestamp, please note we will not review it and your application will receive no further consideration. Next slide, please. Eligibility for this competition is limited to local municipalities, and this includes county or parish governments, and city or township governments. This project is part of an overall coordinated and multi-pronged approach to distributing COVID-19 relief funds. Funds available to state and U.S. territory applicants will be distributed through CDC. You can find their listing on grants.gov by searching the assistance listing or CFDA number 93.391 or the opportunity number CDC-RFA-OT21-2103. Funding for tribes, tribal organizations, and nonprofit urban Indian health organizations will be distributed through the Indian Health Service using existing methodologies. Next slide, please. You are not required to provide cost sharing or matching in your proposed budget. However, if you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. Note that during the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget to support the proposed project. Applications that do include voluntary cost sharing or matching that result in an award will include that commitment on the notice of award at the level proposed in the application, and you will be held to that commitment unless you receive prior approval from the Grants Management Officer during a budget revision during the course of the award. Next slide, please. We will review your application to determine whether or not it meets the responsiveness criteria identified in section E3 of the NOFO on page 11. If your application does not meet the responsiveness criterion, we will disqualify it from the competition at that point. It will not go to review beyond the initial screening. As mentioned earlier, we do have a responsive criterion. You must identify an urban, as defined by the U.S. Census Bureau, or rural, as defined by HRSA, area of focus in the first sentence of the project narrative. This will greatly facilitate the review process and enable us to move the COVID funding out into the community as soon as possible. Next slide, please. The Notice of Funding Opportunity, or what we call the NOFO, provides information and guidance related to applications. Read the entire funding announcement. Follow the NOFO carefully. The information provided in the NOFO takes precedence over any conflicting information in other documents or even this webinar. Next slide, please. To obtain an application package, you can do so electronically by accessing grants.gov at www.grants.gov, and you may find the listing, find the NOFO by searching on the assistance listing, formerly known as the CFDA number, which is found on page 2 of the NOFO, or here on the slide, 93.137. Be sure to subscribe to the announcement in grants.gov so that you'll receive notification of any updates that we make to the NOFO or the supporting documentation, including the upload of this webinar, updates to the FAQ, or any other documents related to this competition. Next slide, please. Now, OASH requires that all applications be submitted electronically through grants.gov, unless an exemption has been granted by the Grants Management Officer, who is me. If you submit an application via any other electronic communication, it will not be accepted for review. So please don't email me your applications. It must come through grants.gov with a timestamp by the due date and time. Now, grants.gov is a website portal. All funding opportunities and grant applications are made available through that portal. An application will not be considered valid until all of the application components are entered into grants.gov and received by the HHS Office of Grants, the OASH Office of Grants and Acquisitions Management, according to the deadline specified in the dates section. If you have any difficulty using the grants.gov system, please contact grants.gov directly with any questions or concerns. We've provided the phone number here. They also have a link to their help desk on the website. They are extremely helpful. Grants.gov is not a system that we maintain and operate ourselves, so it's best to work with the source to understand and troubleshoot any difficulties with that system. Next slide, please. When you submit your application, you're going to need to submit 3 separate files. The first file is going to be your entire project narrative, as described in section F on page 14. That does have a page limit, 5 pages. Your second file, the entire budget narrative, including supporting documentation described in the budget narrative content section of the NOFO. There are no page limits on this file. And then the third file, all documents that constitute your appendices, which would be uploaded as attachments to your application, and there is a page limit on those as well that contributes to the total package page limit. Please note that the required standard forms do not apply to your total page count limitations in the submission requirements as stated in the disqualification criteria in section E4. Next slide, please. Any files that are uploaded or attached to a grants.gov application must be of one of the following file formats. You can submit Microsoft Word, PowerPoint, Adobe PDF, or one of the 4 image formats, JPEG, GIF, TIFF, or bitmap. Please note that we do not accept Microsoft Excel files. They will not be converted on our end, so please don't submit them. And we do strongly recommend that your applications be converted to and uploaded as PDF files whenever possible. This allows you to ensure that there have been no unintentional formatting or reformatting in the conversion of your document and the submission of it, or the submission of an editable document. It also allows you to check your page count of both the PDF, and we even suggest printing out a copy of your application package just to ensure that it does stick within the page limit. Next slide, please. Please be complete in your application and do not leave blanks on the forms unless the information is clearly not applicable to you. And please note the individual submitting the application forms through grants.gov must have the legal authority to act on behalf of the organization. Next slide, please. To ensure a successful submission of your application, carefully follow the step-by-step instructions, and these are provided on the grants.gov website. These instructions are kept up to date and also provide links to frequently asked questions about grants.gov and other troubleshooting information. Next slide. So the total application package includes 5 forms, plus the 3 files that we've discussed previously. Of the forms, you're going to need an application for federal assistance, SF424, the budget information for non-construction programs, SF424A, assurances for non-construction programs, SF424B, a disclosure of lobbying activities, SFLLL, and a project abstract summary. These forms are all included and ready for you as part of the application kit that is posted on grants.gov. So you don't need to go looking for them. They should be there. And then again, you're going to have your 3 files, your project narrative as a single acceptable file, your budget narrative as a single acceptable file, and then your appendices combined and submitted as a single acceptable file. Next slide, please. Please be sure to follow the project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative. You must use 12-point font. You should use an easily readable typeface, such as Times New Roman or Arial. You may see a trend as we finish through this list. We basically want your proposal to be readable. We don't want the reviewers to have to strain to understand what it is you've put on the page. Now, you may use single space when constructing tables or use alternate fonts, but you must ensure that tables are easy to read. When it comes to your appendices in your budget narrative, you should use the same formatting as specified for the project narrative. However, in the appendix documents, for things such as resumes, you may use alternate formats that are common to such documents. Next slide, please. The DUNS number and the system for award management. At grants.gov, under a normal circumstance or non-pandemic situation, will reject submissions from applicants with non-existent or expired SAM registrations. And to have a valid SAM registration, you must have a valid DUNS number. However, because of possible difficulties in registering and renewing SAM registrations prior to the application due date, applicants only need to have a DUNS number or a temporary DUNS number that has been provided by grants.gov to submit an application. We suggest that you start these processes now. Applicants are advised to begin the SAM registration process immediately if you are not already registered or do not have an active registration, because an active registration may be required prior to receiving an award. Next slide, please. SAM is the system for award management. If you're registering a new entity in SAM.gov, you're first going to need to create a login.gov account if you don't already have one. Please note, again, you need to start this process as early as possible because the complete process for registering a new entity in SAM involves submission of a notarized letter by mail. If you're renewing your registration, your old SAM.gov username and password may not work anymore. You will need to create a login.gov account if you do not already have one. And the minimum time frame to complete the initial SAM registration online, that's the online portion of the registration, is about 30 minutes. Time frame for an applicant's registration to become active is up to 10 days and may take longer depending on volume or mail delays. SAM registration must be renewed each year. The average timeline or time frame for an update to occur between sam.gov and grants.gov for the two systems to sync up completely can be up to 72 hours. The moral of the story is please start this process now if you're not already registered, and if you are registered or believe you are, please check and confirm that your registration is still valid and will be valid up through the potential award date. Next slide, please. We strongly recommend you check for an active registration in SAM well before the application deadline. If you're successful and receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you have not complied with the SAM registration requirements, please note we may determine that you are not qualified to receive an award, and we may use that determination as a basis for making an award to another applicant instead of you. Should you successfully compete and receive an award under this announcement, please note all first-tier subaward recipients must also have a DUNS number at the time you, the recipient, would be making a subaward to them. Next slide, please. If you're successful and you receive an award, by accepting the award, you agree that the award and the activities conducted underneath thereunder the award are subject to all provisions of the Uniform Administrative Requirements currently in effect or implemented during the period of the award, as well as other departmental regulations and policies in effect at the time of the award and applicable statutory provisions. Any costs associated with the award or charged to the award must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with the regulations and current policies. Indirect costs may be included per the regulation at 45 CFR 75.414. And as noted in section F3, you should indicate which method or rate is going to be used for your indirect costs in this application. Please note pre-award costs are not allowed, and there is a current salary limitation of $199,300 effective January 2021. This rate, this limitation is updated in January most years. Next slide, please. When it comes to the budget, as we mentioned, the forms, the narrative, and the detailed justification do not count toward the overall page limit of the application. The budget consists of standard form 424A, the budget narrative, and the detailed budget justification. This must be consistent with the requirements identified in the notice of funding opportunity. Budgeted costs must reflect the proposed activities. Budget line item descriptions and justification requirements are all explained in the NOFO, as well as we do provide suggested table formats in the NOFO. Also, please note, you need to include a plan for oversight of federal award funds, and we have provided an appendix as well to the NOFO for some considerations related to that. Next slide, please. So for your application to make it to review, you need to not be disqualified. So you need to meet the following requirements to not be disqualified. Your application must be submitted electronically via grants.gov by the due date and time. We do describe the procedure in the NOFO for an exemption if that's needed. If you successfully submit multiple applications for the same project, we will only review the last application received by the deadline and assume that the others are drafts and not review those. Now, it is my office and my staff that reviews the applications and deems whether or not the application is eligible. Your project narrative must be double-spaced on the equivalent of 8.5 by 11 page with 1-inch margins on all sides and a font not less than 12 points. Project narrative must not exceed 5 pages, and the total application, including project narrative and appendices, must not exceed 15 pages. Next slide, please. If your application does not meet the following requirements, it will also be disqualified and receive no further consideration. Your federal funds request, including the indirect costs, cannot exceed the maximum indicated as an award ceiling. We have 2 different award ceilings depending on what your focus area is. It's $4 million for urban communities focus and $3 million for rural communities focus. Please note, if you have included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. Also, your application needs to meet the application responsiveness criteria identified in section E3. Next slide, please. And that responsiveness criteria is in the first sentence of your project narrative. You must identify your project as having either an urban, as defined by the U.S. Census Bureau, or rural area focus as defined by HRSA. Next slide, please. Please note that applications that lack required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So if you submit additional appendix files, those additional files beyond the page limit will not be submitted to the panel for review. Also, if you omit submitting bio sketches for key personnel, it will not prevent your application from going to review, but the reviewers will have less information to assess components under the scoring criteria. So please be sure to follow the submission instructions carefully. Next slide, please. As mentioned earlier, your application will be reviewed using 3 equally weighted criteria. Those are going to be the statement of need, the proposed approach, and the organizational capacity. Next slide. And these are going to be reviewed under our process. Eligible applications will move on to the review process and be reviewed and scored by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFO. Our process is referred to as the ORC, or the Objective Review Committee, and this process is formal and confidential. Federal staff are available for questions to ensure that the process is consistent and fair, but do not participate in the actual discussion or scoring of the proposals. It is only after the proposals are reviewed by the ORC and we receive their report that applications are then reviewed by my staff for administrative and business compliance, as well as the OMH Program Office staff for programmatic compliance. Next slide. As the Director of the Office of Minority Health, who will make final award selections to be recommended to the Grants Management Officer for risk analysis. Upon completion of the risk analysis and concurrence by the Grants Management Officer, we would then issue notice of awards to those selected for award. Please note, no award decision is final until the notice of award is issued. All award decisions, including the level of funding, if an award is made, are final and you may not appeal. Next slide. We are not obligated to make any federal award as a result of this opportunity announcement. Only the grants officer can bind the federal government to the expenditure of funds. Please note, if you receive communications to negotiate an award or request additional or clarifying information, that request will come from my staff. And that request does not mean that you will receive an award. It only means that your application is still under consideration. All award decisions, including the level of funding, if an award is made, are final and you may not appeal. Next slide, please. When we receive the list of recommendations for funding from the program office, my staff will evaluate each application in the fundable range for risks posed by the applicant before issuing an award, and this is required of us by our regulation 45 CFR 75.205. And we use a risk-based approach and may consider any items such as the following, which are stated in the NOFO. We will look at your financial stability, the quality of your management systems, and your ability to meet the management standards prescribed in the reg. We will also look at your history of performance, particularly in managing federal awards, including your timeliness with compliance and compliance with applicable reporting requirements and conformance to the terms and conditions of your previous federal awards. We will also look at reports and findings from audits, and also your ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. When preparing your plan for federal award oversight, please consult with Appendix F, which has a series of questions that many folks find useful. And if your internal controls are available online, you may provide a link to those as part of your plan in the budget narrative, and that speeds up the risk assessments later on should you be recommended for funding. Next slide, please. When we choose not to fund an application based on the results of the risk review, there are certain circumstances that require us to report our determination to FAPIS. It's the Federal Integrity System. The standards in that review include, at a minimum, if you are a prior federal award recipient, the information currently in FAPIS about you must demonstrate a satisfactory record of executing programs or activities under federal grants, cooperative agreements, or procurement awards or contracts, and must also show that you maintain integrity and business ethics. Now, please note, if we are required to report something to FAPIS, the data in FAPIS is available to other federal organizations to review when considering you for an award from their organization. Next slide, please. As I mentioned before, the notice of award is the document that reflects the final decision on funding, and it notifies the successful applicant of their selection, as well as the award amount, the project, and budget periods. The notice of award, or NOA as we call it, includes any conditions on the award, such as requirements that must be met as a condition of receiving grant funds under a particular announcement. It also includes the standard terms, reporting requirements, and contact information for our staff and the program office staff who will be overseeing the award. Next slide, please. GAM, Grants and Acquisitions Management Division in OASH, is the official contact for awardees throughout the award lifecycle. All official communication related to an award is between my staff and the successful applicant. If you are an unsuccessful applicant, you will be notified by the Office of Minority Health Program Office by a letter at the end of the competition. Next slide, please. We've put together a consolidated list of tips for folks to remember. It's a little bit more easy reference than flipping through a lot of slides. When you're doing your project narrative description, be clear, complete, and concise. Follow and address exactly what is being requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the score. Please note, reviewers are not allowed to do external research, follow embedded links, etc. You can't circumvent the page limitation by just dropping a link in. They aren't allowed to go and look. Clearly identify the sections of the application and indicate which component is being addressed. Project narrative must include all required information within the page limit. Don't use the appendices to expand the page limit. Next slide, please. Please make your goals and objectives SMART: specific, measurable, achievable, realistic, and time-framed. The activities presented in any work plan should relate directly to the proposed goals and objectives, and the work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs, as well as address the purpose and expectations described in the NOFO. Next slide. When you're describing your staffing, the staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Be complete in describing what staff will do, the expertise required, and the percentage of time that they will be assigned to the project. Next slide. When it comes to the budget should include adequate funds to carry out the proposed work plan, evaluation plan, and the administrative responsibilities of the project. It should be reasonable and relate directly to the goals and objectives. Do not request more funds than are available, as listed in the NOFO under the award ceiling. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, if non-federal funds are going to be used, projected program income from fees or third-party payers or other contributing funds. Next slide, please. Electronic submission is required. Please don't wait to the last minute to begin SAM registration or update your current registration. And please don't wait until the last minute to begin the actual electronic submission of your proposal through grants.gov. Problems could arise. Next slide, please. Finally, should you have any questions regarding the NOFO, we have several contact points on the program side. Paul Rodriguez in the program office, and in my office, Senior Grants Management Specialist Roscoe Brunson. Both are available to answer questions. Given the current situation with the pandemic, it is easiest to get a hold of them by email, and that would be the fastest way to get a response back from them. Should you have any questions about grants.gov, the application as far as technical questions, grants.gov, support@grants.gov is the email to contact. They're very responsive. When you do, or if you do work with grants.gov and work with their help desk, please get a ticket number on the off chance that we need to, at some point, review or assess a problem. That ticket number makes it infinitely easier for us to track down what has happened. And with that, that's the administrative business side of the application process, and I will turn things back over to Sunsari.
Thank you, Scott. And so we will begin with several questions received regarding eligibility. The first question is directed towards Juliet. If you would, Juliet, if you would clarify what applicants are eligible and how will they be defined for this funding opportunity?
Sure. Thanks, Sunsari, and thanks for the question. So eligible applicants for this funding opportunity are legally recognized local municipalities. And examples of that are city, township, borough, parish governments, and county governments across the states and commonwealths of the United States. Other eligible applicants could also include water use cooperatives and even school districts. What this excludes, so applicants that are not eligible would be states, territories, tribes, tribal organizations, and nonprofit urban Indian health organizations.
Thanks, Juliet. The next question is also directed to eligibility. And that is, we have a situation where there's a neighboring localities. There are a few neighboring localities who would like to coordinate their efforts and apply for this funding opportunity to provide services. The question is, can the interested organization or organizations apply as a group or form a consortium? Or does one locality have to be the lead? Juliet. It's our
Sure, thanks for that question too. Yeah, so unless there's already a 501c3 consortium in place at the time that you submit the application, one locality has to be designated as the lead of the group to be the awardee that's responsible for the management of the overall project if that application is selected for an award. But indeed, we encourage every locality to develop solutions that work best for your community. So if this involves close coordination with neighboring localities, we encourage you to do so. If there's more questions about eligibility of a group, you can contact the grants management specialist that's on this slide here, Roscoe Brunson.
Thank you. And so the next question is concerning the District of Columbia. Can you tell us if the District of Columbia is considered a state or a locality for the purposes of this funding opportunity?
Yeah, good question. So for this funding opportunity, the District of Columbia is considered a locality and therefore is eligible to apply.
Thank you. And so we have several questions concerning the preparing to apply. And so let's take question number 1 here. And that is, what is the deadline for submitting an application in response to the funding opportunity? And that question is for Juliet. What is the deadline?
Oh, yes. So again, the deadline is April 20th at 6 p.m. Eastern Time.
Thank you. And next question, and this is also within the same theme in terms of preparing to apply. If you would, Juliet, if you would let us know, how can we stay up to date on any updates or changes to the Notice of Funding Opportunity or any additional resources?
Yes, absolutely. So I hope everyone has done this already, but the best way to stay up to date is to subscribe to this NOFO on grants.gov. So you would go to grants.gov and search for this funding opportunity number, MPCPI 21006. There's a red subscribe button that you'll see, and you'll be prompted to enter username or password if you have an account or to establish one, and then you'll be able to subscribe and get alerts anytime there are changes to the NOFO or additional information or resources added.
Thanks. And so the next couple of questions are specific to the focus of this Notice of Funding Opportunity. And so Juliet, if you would tell us, what is health literacy and why is OMH focusing on health literacy for COVID?
Yeah, sure. So the definition that we use for the purposes of the NOFO I went over earlier, and you can find it in the glossary of the NOFO. But again, health literacy covers both personal health literacy and organizational health literacy. So on the personal side, it's the degree to which individuals can find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And on the organizational side, it's the degree to which organizations equitably help individuals find, understand, and use information and services to inform their decisions and actions. So health literacy is a recognized support for increasing participation in healthcare, for improving health outcomes, and addressing health disparities. And we know that health literacy requires a really complex group of reading, listening, analytical, and decision-making skills, as well as the ability to apply these skills to health situations. And so if folks want to know more about health literacy, you can find that information in the NOFO. And also, I recommend that you also visit the Healthy People 2030 website.
Okay, thank you. And so for our final question, Juliet, if you could tell us what is health equity? We've been hearing a lot about that. If you could just briefly, if you would let us know, what is health equity?
Yes, of course. So for the purposes of this NOFO, and you'll also find this definition in the glossary, health equity refers to the attainment of the highest level of health for all people. And achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities.
Thank you. And so if you would advance the slides to slide number 60, please. And so in closing, We strongly recommend that individuals interested in the NOFO register on www.grants.gov to receive updates that would include any revisions or updates to the NOFO, a list of frequently asked questions with responses, and that will include responses to questions that were entered in our chat box today that we were unable to answer during the webinar. Also, we will upload slides from today's webinar and any additional resource documents and links. Please note the webinar recording will be available on OMH's YouTube channel. If you have program questions regarding the NOFO, please email your question to paul.rodriguez@hhs.gov. If you have administrative or financial questions, email your question to roscoe.brunson, BRUNSON, @hhs.gov. This concludes today's webinar. Thank you to our presenters, and thank you for your interest in this funding opportunity. Good day.